Welcome to the Good Health Revolution, South Africa's largest ever online health and wellness event, where we have brought together the country's leading experts who will reveal powerful strategies with you on how you can improve your health and create a life of energy and vitality, starting today. Health and healing does not have to be difficult, restrictive, or even overwhelming. We are going to show you how fun, easy, and effective it can really be. All you need is the right guidance, accountability, an open mind, and an attitude of curiosity. Don't forget, if you would like to own this entire series to share with your family and friends, as well as get your hands on a variety of resources that will support you in a big way to reach your health goals, just click the VIP upgrade button on your screen to get access. So are you ready to create a life your future self will thank you for? Let's get started. Enjoy the show. Hey there, and welcome back to the Good Health Revolution. I'm your host, Stephanie Grosvenor, owner of Unlimited You Coaching and co-founder of Vitamin G Nutraceuticals. Today on the Good Health Revolution, I'm beyond excited to welcome Dr. Fariel Luha to the show. Dr. Fariel, welcome. Thank you so much for offering up your time to be with us today.
It's only my pleasure, Stephanie. I'm really excited to be here. Thank you.
I know we are going to have an incredible conversation. I think the trickiest part is going to be keeping it down to 30 minutes.
Right.
Every time you and I get on a call and we chat, we can just go on and on and on. There's so much synergy, so much energy, and such great conversation that really comes out when we have a chat. So before we get into it, let me not ramble on. We've got a lot to cover, but I quickly want to read off your bio to give the audience a bit of a background, and then we'll get started.
Sounds great.
With a passion for the body's innate healing power and the integration of naturopathic medicines and therapies, Fariel offers patients comprehensive naturopathic medicine care and education to optimize their health and well-being. Using a holistic approach, Fariel strives to uncover the root cause of disease through clinical experience and the use of innovative laboratory assessments. Treatment plans are tailor-made to suit each individual's specific needs and goals while supporting the individual's inherent capacity to heal. Treatment modalities incorporate functional medicine approaches and include clinical nutrition therapy, botanical medicines, Chinese medicine, acupuncture and cupping, supplementation, and lifestyle consultation. Dr. Fariel has a focus on women's health. However, she treats a wide range of conditions from chronic pain syndromes such as migraines to chronic disease such as diabetes. Dr. Fariel graduated from the Canadian College of Naturopathic Medicine. She has been in practice for a combined 17 years, starting initially in Canada, and currently splits her practice time between South Africa and Dubai. She aims to empower and educate her patients to take charge of their health by living a happy, balanced life full of vitality and possibilities. What an incredible mission that you have. I'm 1000% in support of that.
Yeah, it's, really rewarding, I have to say. I mean, I've been in practice for 17 years. Sometimes it doesn't really feel like it. And yeah, I love what I do. I've been really lucky to combine the travel with my work. And it's been an awesome journey so far.
Definitely. The love and the passion you have for what you do definitely shows every single time you speak about it. So I'm grateful to have you share that passion with us on the event. I love how you've been able to combine your passion for medicine and health and healing with your passion for traveling as well. And you've really been able to make that work for you and your family. It's definitely something that I'm in the process of doing as well. And it's just amazing to be able to help people on many different continents from many different cultures.
Yeah, it really is. And, it's actually a privilege for me also that what I practice and what I'm bringing to the table is actually something many people are really hungry for. Like, they're quite receptive. They really are looking for a different path, something that is going to honor their own body's physiology. And at the same time, it's interesting because I get to appreciate different cultures and customs and how things are done, and even use some of the indigenous therapies or treatments that are available. So, I say that every patient for me is a teacher, and it's really been really such a wonderful experience to be able to do that.
That's beautiful. That's beautiful. You learn a lot more from your patients and your clients than you do from a textbook, right?
Correct. Yeah,
Well,
absolutely.
today you and I are going to be jumping into a very important topic, and that is thyroid health and a lot of thyroid conditions that people are experiencing. We are seeing thyroid issues, particularly something that we call Hashimoto's thyroiditis. This is increasing at an astronomical level. And every year, the statistics are growing more and more and more and more. And if I'm not mistaken, if we look at in the States, about 45% of women are dealing with a thyroid condition, 25% of that of which is completely undiagnosed. They do not know that this is what they're dealing with. And even though that's an American statistic, I am sure it's not far off in South Africa, because there are so many women that I've spoken to in the last 2 years that are sharing their symptoms with me, and it's immediately I can tell straight away that it's a thyroid issue they're dealing with, likely Hashimoto's, and it's something they've been living with for years, not knowing, and only once they go and they get tested and they do the lab work does it come out positive. So I'd really like to shed some light on this condition and thyroid issues in general, and what we can do. First of all, like, what is causing it? Why do we have such an increase? And then what we can do to support our thyroid health. And that's really what you and I are going to be unpacking today during our talk.
And I hope we can get, as much information out there to people, not just to be able to recognize that this could potentially be something that they need to check out for themselves, because as you rightly said, it's either underdiagnosed or completely misdiagnosed. And also to be able to just provide some solutions, because it's a very complex situation. The thyroid gland is responsible for very, certain, how should I say, physiological things going on in the body. Symptoms vary from person to person, and women are affected about 7 times more than men. So it's not that men don't get the Hashimoto's autoimmune thyroiditis, but it certainly affects women more.
Definitely. So I'm sure there is a large part of our audience that is listening that is dealing with a thyroid condition, but there may be just as many people listening that are dealing with certain symptoms, but again, undiagnosed, have never thought that possibly it could be related to my thyroid. So will you share with us a little bit about the most common symptoms that you would maybe experience to indicate you have a thyroid issue, as well as what some of the thyroid issues are that are most common that people are dealing with?
So I'll start first by just talking a little bit about the thyroid gland. For those who are familiar, they'll know that it sits right at the base of the neck here. It's sort of like a butterfly-shaped organ, And the thyroid gland, from a naturopathic point of view, is really the intelligence or data center of the body. It's that important because it is releasing hormones that are important in terms of deciding how the body is going to use whatever nutrients are coming into the body for fuel, for energy. So the energy distribution in the body is actually determined by the thyroid gland, and it also sets the sort of metabolic rate. So metabolism is how we're using energy coming in from the food we're eating to be able to fuel our cells and our organ systems to function. And so when the metabolic physiology and the rhythm is off, you could have somebody whose metabolic rate is very high or very low, and there are going to be different symptoms related to that. But the thyroid gland is also very intimately linked to other organ systems. It has a very, very close relationship with the gut, with gut health, with adrenal health. So stress is going to play a big role here, where when individuals are undergoing stress for prolonged periods of time, then they can start to develop a thyroid disorder, because the adrenal glands will start to tug on the thyroid gland for more support. As you know, the adrenal glands release one of the most powerful stress hormones called cortisol to help us basically get through our day with all the different minor, major, positive, negative stresses that we deal with. But in the last few years, I think you would agree that our stress levels have been quite high, with the pandemic, with all the factors related to job losses, financial issues, sick loved ones that are suffering, deaths in the family, even the social isolation, right, that many of us had to endure. And we can have one disorder on top of another. So it is very complex. The thyroid gland also, has this interesting interaction or crosstalk with the reproductive hormones. So with women, there's a very close relationship with estrogen and progesterone, which are the two main female hormones. And so this is where you might see menstrual irregularities. And many women will come in first reporting that they're having irregular periods, or their periods are happening twice in a month, or they're quite painful, or they just have all these other symptoms. And so it does impact reproduction, it impacts fertility as well. And some of the more sort of, the symptoms that would be presenting that are more remarkable would be just lots of fatigue. So they will come in complaining of very, very low energy levels, brain fog, just having this cognitive sort of issues with respect to concentration, with being able to retain information or stay on task, like they have to repeat a task a few times. You can also have mood regulation issues. So a lot of people who have thyroid imbalances will report having anxiety, depressive moods. So the thyroid operates on a spectrum, right? We've got low thyroid function on the one hand, which is also known as hypothyroidism. And then on the other hand, you have hyperthyroidism, which is where there's too much thyroid hormone output. And so the symptoms will vary. So for example, a hypothyroid person will be the one that's feeling very lethargic, very sluggish. They are also having some digestive disturbances because, as I said, there's a close relationship with the gut. So there's constipation. They can have dry skin, a lot of hair fall, and then the anxiety, the depression, that will also set in. Whereas someone who's hyperthyroid, they're going to have sort of the opposite symptoms. So they might be kind of more high strung, more hyperactive. They have, their heart is always racing. They feel like they've got palpitations. It goes from more of an anxiety to a more of a high strung, like worrying about things all the time. And then they have difficulty sleeping because their energy output is so high that they can't sort of calm down, and they lose a lot of weight. Whereas the hypothyroid patient tends to gain weight very easily and has difficulty losing weight because, as I said, it's impacting metabolism and energy distribution. So that's sort of the spectrum. But then in there somewhere, we will start to have this autoimmune component coming in, where now whatever the triggers are, whether they're environmental, whether it's in the food or just stress levels in general, are starting to impact the immune system. And then the immune system mounts this unusual, abnormal hyper response and starts actually to attack the cells of the thyroid gland. And that damage then creates more issues with respect to how the thyroid functions. And that's what's called Hashimoto's.
Okay. Okay. Amazing. Amazing explanation. It's so easy to understand. Thank you for sharing that. There are so many like golden nuggets that you were sharing there. And I want to come back to that stress, the gut health, the food. There's so much for us to unpack here, but let's start off with food. So what are some of the most common food triggers that can initiate Hashimoto's or these thyroid issues?
The most common food triggers that I've seen in practice will be gluten, first of all. That's usually the number one, typically coming from wheat. But as we know, there are many grains that contain gluten. It's just that the wheat is the one that's the most inflammatory. So it's a great question, because I do want to point out that, when we talk about autoimmune conditions, the idea is that somehow our immune system has suddenly forgotten that the thyroid gland belongs to itself, to that body, and just starts attacking it. So I know that I'm simplifying it. It's not that simple. It's not so much that the immune system just decides to wake up one day and say, thyroid, I hate you, I'm going to attack you. It's not that, because our bodies are really wise machines, and they're always looking to help us thrive, not just survive, and to actually always not just maintain homeostasis, but to actually have lots of vitality, right? So the body wouldn't just do that. In its innate wisdom, what's happening is there's something that is circulating in the system that the immune system is responding to, that looks like, it's called molecular mimicry, looks like the thyroid. And so in its attempt to get rid of that foreign body or particle that is offensive, it is attacking the thyroid. And so interestingly, gluten, the molecules actually look like thyroid cells. Okay, that's one thing. There could also be an underlying infection, a viral infection, something like Epstein-Barr virus or some other virus that's laying dormant. And again, the immune system is trying to get rid of that virus that maybe could be circulating around the thyroid. And so in its wisdom, in trying to attempt to remove the offending agent, it looks like it's attacking the thyroid, right? Mold is another one, which could be a big underlying contributor to autoimmune. And again, that will cause the immune system to hyper react. So with respect to food, gluten is the number one, but the others that I've seen definitely that play a role, because the moment we remove them, things improve dramatically, are dairy coming from a cow. And then we can have soy. Soy is a big one, especially when it comes to autoimmune. And then we have others like eggs, citrus, sugars, of course. And I think it goes without saying that processed foods in general, if one is eating lots of processed foods, laden with chemicals and additives and sugars and things that we can't recognize, certainly that's going to contribute to this hyper response from the immune system.
Thank you for sharing that. And it's unbelievable how powerful our food can be in managing these conditions or reversing these conditions. And I was talking not that long ago to one of the nutritional therapists on my wellness team. And she's based in the States, and she doesn't have Hashimoto's, but she went about a year and a half ago to have her thyroid levels checked. It's always good to do this on a regular basis. And they picked up thyroid antibodies in her system. It wasn't Hashimoto's, but there was the presence, her antibodies were elevated. And this is what happens. Your antibodies are basically these little bullets that are like attacking the thyroid that you want to get rid of. And the longer you have these antibodies and the more of them that are produced, the higher at risk you become of developing either Graves' or Hashimoto's or even thyroid cancer. So why I'm sharing this is because she had her levels tested. They were elevated. And all she did for 3 months, she went strictly gluten-free. She made no other changes, but for 3 months went strictly gluten-free. Went and retested them, and all the antibodies were normal. There was no antibodies present. Her thyroid levels were normal. But changing absolutely nothing else, just removing gluten, the body stopped to attack the thyroid. So your food is incredibly, incredibly powerful, and it all comes back to that molecular mimicry that you were sharing. And I'm glad you mentioned the presence of mold or Epstein-Barr as a huge one as well. And I think this is important for people to understand. When they are potentially on thyroid medication and it's either not working, or you will find it's very common that you're on these medications and every 6 months or every year you need to increase your dose. And you're like, well, thinking, if I'm taking medication, why does it should be making me better, right? Like, why am I need to increase the dose? And it comes back to, well, is the root cause gluten? Is it Epstein-Barr? Is it mold? Is it genetic? What is going on? Because these medications are masking the symptoms, but they're not fixing that root cause. So the Epstein-Barr is just getting worse. The gluten-related antibodies are getting worse. And this is why medication needs to continuously be increased, because your internal state is getting worse because the root cause is not being dealt with, right?
Absolutely. Absolutely. And unfortunately, this is the sort of standard gold treatment when it comes to treating, if we're speaking specifically about Hashimoto's. First of all, as you said, it's often not commonly diagnosed when people are suffering from these symptoms. And, this is one of the things that I'd really like people to appreciate, is that if you're suspecting that you've got a thyroid issue, please get a full thyroid panel done. Please do not settle for just a TSH and a T4, free T4. That unfortunately just gives us a little piece of the puzzle. It's not explaining the full physiology of the thyroid. And when I check a thyroid panel, I'm checking 6 different markers. five
Yes.
or six different markers, right? Because, I of course I do the TSH and the free T4, but TSH is not a thyroid hormone. It's a pituitary hormone. It is released from a gland in the brain called the pituitary hormone, and it is simply a messenger that goes to the thyroid gland and knocks on the door and says, hey, can you please make thyroid hormone? Okay. The active thyroid hormone is T3. But T3, which is normally released in very small amounts but has a huge impact, has to be converted into its active form from T4. T4 is inactive, produced in large amounts, but it does not do the physiological work that the T3 does. And about 60% of that conversion is happening in the gut.
Wow.
So, suffice it to say that if your liver, gallbladder, pancreas, digestive system in general, your stomach, your intestines, your colon, your intestinal lining, if there's any breach there, if things are not working there, we were going to have a compromise in the ability for T4 to convert effectively into T3, which is the active thyroid hormone.
Yes.
On top of that, I always encourage people to get their antibodies tested, the anti-TPO, the anti-TG, because these antibodies actually attack the enzymes that are converting that T4 into T3, all right, in the thyroid gland and further damage the thyroid cells. And interestingly, the antibodies will typically rise first for a long time before your thyroid panel, your TSH, T4, T3 are even going to go out of range. So, when you go to the doctor's office, you're complaining about things, and it could be something called subclinical hypothyroidism, which means you have all the symptoms, but on the lab work, it's just not showing up. They're going to say to you, no, take this prescription or take this drug, or don't worry about it, just, change your diet or what have you. But they haven't checked the antibodies, which could be quite high, because that's what goes awry first.
Yes.
So I do check those two. I also check reverse T3 in some cases, because the T3 can then be converted back into another inactive form called reverse T3. So these are just some things people should be aware of if they're wanting to really understand if the thyroid is what's causing some of their symptoms. But as you said, it's important to also appreciate that the drug people are usually being prescribed, levothyroxine, euthyrox, L-troxin. Unfortunately, Stephanie, one of the bigger issues with this, because all the time I'm hearing it from patients who come in to see me and say, Dr. Luhar, I'm taking these medications. Why is it that my thyroid issues are still worsening, or we keep having to change the dosages, as you said? And the reason for that is because, guess what? These drugs are mostly T4. They still have to be converted into an active thyroid hormone. And there are many factors, which I'm sure we can get into, that actually impact this conversion. So if someone's having an issue with being able to produce more thyroid hormone because of a conversion issue, that drug may or may not help them as much. The other interesting factor is I think it's about 15 to 20% of the population actually have a defect. They have a defect in the drug that helps to have it converted into an active thyroid hormone. So for this reason, it won't work.
Wow.
And certainly doesn't touch the antibodies. The only thing that touches the antibodies is your nutrition and lifestyle medicine, which is what I've seen in my experience to be the best thing to get people into remission.
100%, 100%. And I would like to go deeper into that conversion and the importance of gut health. Like, what do we need to be doing to look after the gut so that we can ensure that conversion? But before we jump into that, I just want to reiterate what you said around the testing. And I really want you guys listening to get this, to understand this. When you are asking for your thyroid panel, your doctor may not tell you or may not suggest to you to get these antibodies tested. And it's a quick Google search. You can email me, you can email Dr. Farial. We can send you exactly what it is that you need to get tested. I do this with people all the time. I actually send out emails regularly letting them know what you need to test, because even recently for myself, I went to the doctor and I asked for this full hormone or thyroid panel. And I asked for the two kinds of antibodies, the thyroglobulin and the thyroid peroxidase, which is, I know, very important. And the doctor said to me that we can't test that. She's the same person who diagnosed my mom with Hashimoto's, my aunt with Hashimoto. She's been with the family a long time. And she said to me, she can't test it, it's unnecessary. So I was a bit disappointed because that's actually what I wanted to know. And when I went to
Right.
with my form, with the blood work, I said, look, she didn't put this on here. Can you not test for it, or did she just not order it? And they said, no, of course they can test for it. So I just added it to the list. They tested it for me, and it came back, and those antibodies were elevated. And I was quite shocked when the doctor sent me my results and she said, everything looks normal, there's no problem. And I looked at the TSH, and my TSH was elevated. The thing is,
Right.
in optimal health, we want the TSH to be 2 or under. But
Correct.
unfortunately, your lab values, as long as it's under 3, it's estimated.
Even under 5, Stephanie. I've
Under
had lab
5.
values under 5. I've seen labs that do under 5 that say it's fine. Yeah.
That is insane. It needs to be under 2. Like, this is crazy. So she obviously
Yeah.
looked at my lab values, and this is how doctors are trained. This is not me speaking bad about any
Conventional doctors.
any
Yes.
conventional doctor. Yes.
Yeah.
And I'm not speaking bad about it. This is the training. But the reality is, I knew that there was something going on with my thyroid. They didn't want to test for it. Luckily, I knew what to ask for. I got the tests, told I was normal. Once I actually looked at it myself, I almost started crying because I'm like, my poor thyroid. But then I was able to start implementing, take some empowered action with diet, lifestyle shifts, and supplementation, and able to bring those antibodies down. So it's important to know what it is that you need tested, and take a strong stand for yourself, for your body, for your health, because doctors are doing the best that they can, but conventional doctors don't always have this information or this insight. But I had just said, great, the doctor says my labs are fine. I've just spent flipping 5,000 Rand on getting all of this done. And they say everything's fine. And I just carry on, and I continue to feel worse. And I go check it maybe a year down the line, and all of a sudden diagnosed with an autoimmune condition. I'm going to be really disappointed. So it's important to really make sure you are testing correctly. You need to test correctly, guys, please. You don't want to be told, if your doctor says your labs are fine and you're still feeling bad, there's a reason for it. Like, continue, just make sure you're getting the right tests, please. If you are investing.
And to add to that, if I may, Stephanie, as you said, you absolutely have to be your own advocate and ask for the testing, because when your doctor said, I can't, it's kind of confusing, because is it that the doctor doesn't feel it's necessary, or is it an issue with the ability to be able to order the test? Like, what does it mean I can't, right? Having said that, you got the test done, and it's a good thing you did, because if your antibodies continue to rise and rise and rise, and perhaps you would have been diagnosed with Hashimoto's at some point, what we need to appreciate is that when people are diagnosed with Hashimoto's, they're going to increase their risk for developing another autoimmune condition like celiac or some other autoimmune. So very important to get that under control, because your thyroid and your immune system are trying to tell you something. But then, of course, we got to figure out, well, where did this come from? And that's the other missing link, I think, with the allopathic community. Certainly not all doctors are like that. I have many colleagues who are integrative doctors or functional medicine doctors, and they understand the root cause medicine side of things, and asking the questions, because there are triggers, there are reasons for which this situation occurs, and we need to circle back to where is it coming from and treat that, as you said at the beginning. And so taking a drug is not addressing that. It's not addressing how it started.
Yes, 100%. Thank you for sharing that. Let's dive into the gut. We don't have too much time left, but this is really important. There's a couple questions I want to cover. So share with us a bit more about gut health and the impact this has, what we can do to fix this conversion issue in our gut.
I'll try to keep it concise, because honestly, I could talk about this, for hours. So what happens with the gut, the intimate relationship that it shares with the thyroid, which many people may not be aware of, is, I'm going to get a little sciencey here, but I'm sure that the audience can appreciate it. So we have, in our intestinal lining, we have these little cells that basically are part of the lining, and they stand shoulder to shoulder, very, very tight. They're called the tight junctions. They prevent things that are inside from leaking out, and they prevent things that are in the exterior of the abdominal cavity to leak in from the bloodstream. And there's a reason for this, because we don't want foods and particles that are being digested to leak out into the system and to irritate other parts of our body. This is called leaky gut. I'm sure you've heard of it, right? So interestingly, the thyroid hormone is actually influencing how tight that membrane is. The tight junctions are influenced by the thyroid hormone. So when there's a breach, because it should look like this, but when there's a breach and you've got these gaps, that's potentially related to thyroid function if there's a thyroid issue. The second thing is related to motility. So as I said before, we have thyroid patients who are dealing with constipation most of the time, especially when it comes to Hashimoto's, and or diarrhea if they're hyperthyroid, but I'm just going to focus on Hashimoto's. And the reason for that is because we have this peristaltic action, this movement along the intestines that helps to get the food moved along, and it's called transit time. Now, the thyroid function is going to impact this. And when there's low thyroid, it slows down motility. So if it slows down motility and transit time, guess what? That food is allowed to sit in the intestines longer, which means there's a greater and a longer opportunity for it to ferment. There's a longer opportunity for bad bacteria to start growing and to start outcrowding and creating what we call dysbiosis. So an imbalance of the good versus the bad bacteria that are in our gut. That's going to cause a whole host of digestive issues. And I see it all the time. And then on top of it, it's obviously going to create constipation because we're not able to evacuate the bowels regularly. And again, I just want to say from a naturopathic point of view, one should be going to the toilet for a bowel movement about an hour or two after every meal. And we'll probably have people falling off their chairs when I say that, because I can't tell you how many times I've had patients come in and say to me, when I ask them, like, how are your bowel movements? And they're like, oh yeah, they're great. Like I go once every 2 or 3 days.
Yeah.
Right?
I have a
And I'm
client
like,
going once every 5 days, and she said,
yeah.
no, she's fine. She goes once a week, but she's always been that way, so it's not a problem. Like, for 45
Well, so
years, you've
then,
gone once a
yeah,
week.
yeah,
How much
correct. So
nonsense is currently there? I'm so sorry.
I always follow that with, oh, so are you only eating like once or twice a week? Is that, because every time you eat, the body is like a factory. It's going to use the nutrients and whatever the wastes are need to leave in a safe, harmless, effective manner. So where are those wastes going? Like it's interesting when we sit and we discuss with the patients, think about it. Where are those wastes going to? Because they haven't left your body. That's a whole other topic, Stephanie, but just to say, motility is so important and thyroid function affects that. Another thing that's really important is the microbiome. So I already touched on this bacterial diversity that we'd love to have in our GI systems, in our gastrointestinal systems, because that not only helps us to extract nutrients from our foods and it helps us to digest foods, but it's also the basis for our immune function, right? 70 to 80% of our immune is sitting in our gut. And so thyroid hormone impacts that whole relationship. We know that the microbiome, there's lots of research on this, microbiome of Hashimoto's patients is a lot different than healthy, normal patients, and actually shows a huge lack of diversity. We want a diversity, right? So of course that's going to impact immunity. You see where I'm going with this, because you've got this low level of good quality healthy bacteria, higher levels of the pathogenic unfriendly bacteria, so that's going to impact immunity. And then finally, I just want to touch on the fact that we also see a lot of thyroid patients reporting issues with cholesterol or gallstones, because a lot of gallstones are made from cholesterol. And so the link there is that thyroid hormone actually allows for the bile. Bile is produced by the liver, but stored and concentrated in the gallbladder to be able to help us emulsify fat-rich foods and break them down and absorb them. And this is very important. It also impacts the ability for us to absorb fat-soluble vitamins, A, D, E, K, any healthy fats. So it's pointless to be taking in these fats if you've got gallbladder dysfunction or bile issues, because you're not able to actually absorb these nutrients. So I have seen many patients who have thyroid disorders have also developed gallstones because their lack of thyroid output is creating the bile to become very thick to the point where it becomes a sludge, to the point where it develops a stone. And then what's the gold standard for stones in the gallbladder? Get it out, remove the gallbladder, right? Which is
Well, I
another,
didn't do anything wrong. He's just
right.
there. We take him out.
Correct. Correct. So then, we're just making the situation worse because now we're unable to emulsify fats. And so it's just important for people to realize that, our digestive function is linked to the gallbladder and the liver, and the thyroid hormone impacts this as well.
Yeah, definitely. That you've explained it so beautifully, and it's always fascinating to me to talk more and learn more about how connected everything is in the body. There's no individuality. It's all one beautifully complex system. The moment we can start to improve one area, so many other areas of our body are going to improve. There are a lot of other questions that I would love to dive into with you. We know sleep, we know stress, all these things play a role on thyroid health, but unfortunately, due to time, we are getting towards the top of our time together, and we've shared incredible information with everybody about thyroid issues and what to look out for and all this kind of stuff. But I would love to give people some hope and some practical steps or tips that they can do right now. Like whether they've been diagnosed with something or they've listened to the symptoms we spoke about and they suspect they have a thyroid issue, whether it's hypo, what are some diet or lifestyle factors that they can start to look at to start to change in order to improve their situation naturally?
So that's a great question. And again, there's so many different things because I wish I could say there's one single thing that a person can do and it's going to change things, but it is a multi-pronged approach. So I think we did discuss already the dietary side of things, just looking at some of these triggers and intolerances and sensitivities. And if one isn't sure, they can always do a food intolerance test as well, which will identify some of these intolerances. I'm not talking about allergies, talking about intolerances, things we've been eating over time that the immune system is now not able to tolerate. That's one thing. And then in terms of taking stuff out, that's all, fine and wonderful, but then what can we eat? So of course, the thyroid gland and any hormone in our body, we need to eat healthy fats. These are things that are going to build hormones. So your olives, extra virgin olive oil, coconut oil, nuts and seeds, fatty fish, avocados. We need to eat good quality protein, ensuring that it's organic as much as possible, which means it hasn't been pumped with antibiotics or hormones. We need to eat lots of produce, again, herbicide, pesticide-free vegetables, fruits, and this is what we mean by gluten-free. Okay, so there's a lot more that I could say in that regard, but I think I also want to point out that if you've got some stress in your life, please address it appropriately. Ensure that you're, utilizing stress management techniques, whether it's, getting some counseling, whether it's meditation or breath work, or just doing things that make you happy and calm. I don't advocate people who have this type of thyroiditis, Hashimoto's and such to be doing any type of high intensity exercise. So yes, we need to move, but it's got to be something that is not creating more of a stress on the body. So things like yoga, Pilates, walking is a great one, swimming if you enjoy it. It's got to be something you enjoy. But I think the one lifestyle factor that really is important is sleep. Because again, what I want to mention is that we are diurnal, not nocturnal beings, meaning that our physiology works in a cyclical manner. There's certain hormones that are produced only during the day, in the daylight, when we're awake. And there's certain hormones that are only produced at night while we're sleeping. And guess what? Thyroid hormone is only produced at night during deep sleep. So if your sleep is disrupted, if you're getting only 4 or 5 hours of sleep, if you're waking up multiple times at night, unfortunately, you are not getting to a point in sleep where we can have that thyroid output to give you enough thyroid hormone at the beginning of your day, the next day, to help you navigate through your day. So these are some of the things, but I think the testing is important. And then when it comes to T4, T3 conversion, there are certain nutrients that are really, really critical for helping with that conversion. Things like magnesium, tyrosine, iodine, vitamin D, iron, just to name a few. So I always encourage my patients, please get your vitamin D levels checked, get your iron levels checked. They're all critical for helping the thyroid to stay balanced.
That is fantastic. Thank you. Thank you. Thank you. Thank you so much.
My
On
pleasure.
the note of getting tested for your supplements, that's another point I want to bring up is the vitamin D testing, because the sort of standard, what do I say, marker that we would see as normal, the standard value we would see
The
as
level.
normal is 20. Now, in order for us to have a vitamin D level that's actually for us to reach optimal health, you want at least over 50, anywhere between 50 and 80. So most of the time when I'm seeing patients, they are between, I want to say 18 to about 37 is their vitamin D level. And that is not sufficient. If I see a level like that, particularly with somebody who's dealing with thyroid issues, I'm like, that's one of the first things we got to do now. Like, let's get your vitamin D. So just letting you guys know, if you are getting your vitamin D checked and it says it's over 20 and everything is normal, doctor says not to worry, I would encourage people to work on their vitamin D level, whether it's through just the sun or getting supplementation. Generally, we would need a bit of supplementation if your level is 20 or around there, and you want to get that up to around 50 at least in order to have proper thyroid function. I don't know what level you advocate for, but for me, I always say at least 50, and we can work on taking it from there.
I do recognize that above 50 is great, especially if you're generally healthy. But when I'm dealing with people who are having more serious issues, and Hashimoto's in particular, I like to see it above 80, to be quite honest, 70 or 80. Yes, because we just want to get them as high as possible, and then we can slowly sort of bring them to a level that's maintained. We have to also be aware that there is something called vitamin D toxicity. So I'm always monitoring my vitamin D levels in my patients. I test them every 2 to 3 months to ensure that we're not going over like 110 or 120. We don't want to do that, but we want to stay in the optimal level. And I think that's the key, is that the distinction between, let's say, you know, the naturopathic functional approach versus the allopathic. So we're not looking to just have people have sufficient levels. We want them to have optimal. We're optimizing because, you know, we need to give them everything they need in order for the body to be able to do what it wants to do, which is to help you to thrive.
Definitely. Definitely. This has been amazing. Thank you so much. Guys, you've heard the importance of sleep. We didn't get a chance to get into details around sleep, but there are 2 interviews in this series that are focused purely on how you can increase not just the quantity of your sleep, but the quality of your sleep. That is just as important. You can be sleeping 7 or 9 hours a day or night, but it could be terrible quality sleep. You won't be producing that thyroid hormone. So make sure you look out for those 2 interviews where you can learn more about how you can improve your sleep. And then Dr. Farial mentioned stress as well. When you signed up, you got a free stress management toolkit. So make sure, if you haven't gone through it, look at the resources I've given you in there and start to implement it. Just take one thing, one suggestion in that book and start to work on it. Like, pick one that stands out to you. But as Dr. Farrell shared, you need to be looking at your sleep. You need to be looking at your stress if you have any hope of managing or reversing or preventing these kinds of thyroid conditions. I so appreciate your time today. It, as always, has been such a pleasure to speak with you, and I really hope to have you back on the show with us again next year.
Thank you, Stephanie. It was really such a wonderful exchange. I really enjoyed it. And yeah, I look forward to more.
We hope you enjoyed our discussion. Don't forget, it is not knowledge that is power. It is what you do with your newfound knowledge that really makes the difference. So act now and start to implement what you have just learned. Your mind, your body, your soul, and your future you will thank you for it. These discussions are only available to view for 24 hours. But if you would like to get lifetime access to re-listen, relearn, and share with your loved ones, then click the VIP upgrade button on your screen. Not only will you receive lifetime access to the event, but you will also get your hands on a private one-on-one Thriving Life creation session with me, Stephanie. You will receive 1 year free subscription to my Sensations Live online cooking class, where we will show you each month how to create delicious meals the whole family will love in 30 minutes or less. You will receive an anti-inflammatory recipe book so you can begin your healing journey in the kitchen, as well as a copy of my ebook showing you how to overcome bloating, digestive issues, and food sensitivities. You will get instant access to the Healthy Living Blueprint 3-day workshop. You will also receive an exciting vitamin G goodie bag and 10% off when you place your next order. But the best part is that you will receive 1 month free access to my signature wellness mentorship called Health Gap. This program is helping people all around the world to transform their health in a totally unique, fun, and practical way. So go ahead and click the VIP upgrade button on your screen now to get over 5,700 Rand in bonuses.